Okay, so we got ectropion. Ectropion refers to eversion of the eyelid, whereby it rests away from the eye. This almost exclusively affects the lower eyelid and may affect only part of the eyelid. Example, medial ectropion, or the whole length of the lid. The causes of ectropions are involutional. With aging, degenerative changes occur within the medial and lateral canthal tendons and the tarsal plate. This can result in overall loosening of the lower eyelid and leads to ectropion. Cicatricial. Scarring of the skin and underlying tissue can pull the eyelid margin away from the eye. This is most commonly caused by prolonged sun exposure with actinic skin changes, but can also occur with burn skin tumor and with some scarring skin condition. Paralytic. Disruption of the facial nerve, the seventh cranial nerve, leads to a lack of tone in the orbicularis oculi muscle. This leads to loosening of the lower eyelid with ectropion and inferior ptosis. This is most commonly seen with Bell's palsy, but may also occur from trauma or tumors along the length of the nerve. Mechanical. Tumors on or near the lid margin can lead to mechanical eversions and ectropion. Inflammatory. Inflammatory eyelid swelling from infections or allergy may lead to ectropion. The main concern with ectropion is disruptions of normal lid function resulting in a disturbance of the ocular surface. This can cause corneal drying and ulcerations, predisposing the eye to microbial keratitis. Symptoms. Epiphora is common, especially with medial ectropion. This results from malpositions of the inferior punctum. A red sore eye and a mucus discharge are also common. Signs. The cause of ectropion should be sought looking for lid laxity, scarring of the skin, facial weaknesses, and eyelid tumor. The ocular surface should be closely examined for signs of epithelial disruption such as punctate fluorescein staining or even ulceration. Management advice. Mild ectropions may require no treatment other than advice to minimize rubbing and trauma of the lower lid to limit progression. Tear supplements. Tear supplements are of prime importance in preventing desiccations of the ocular surface from the eyelid dysfunctions seen with ectropion. If the ocular surface is disrupted, lubricant drops and ointments are important. After applications of the lubricant, active blinking and even manual support of the lower lid may be important to facilitate distribution of the drops or ointments across the ocular surface. During the day, ocular protections can be aided with the use of sunglasses with good sight protection.